It's like a nice small community feel with the care of a big university hospital.
This is the kind of place that you can deliver the nursing care that you hoped to deliver when you graduated.
There's a sense of belonging here. You're part of a family.
From the first day, I knew oncology is what I wanted to do, and this place was where I wanted to be.
Sometimes at Fox Chase we'll be doing a procedure that is so complex that it wouldn't be attempted at other institutions.
We work on our unit as a team to make sure everything runs smoothly.
This is where I belong, and I'm hoping that this is where I end my nursing career.
I'm a staff RN on the surgical step-down unit. I work the overnight shift.
Hello.
When you go to a hospital that has magnet nursing, you should expect exceptional care. I think that patients here need a little more than some places. They're going through the fight of their life, and I think you need to have that extra time to spend with them. The patient load we get here is pretty manageable. When I came here at Fox Chase in my clinicals, I just was like, this is so rewarding. I just loved it here.
Caring for somebody, getting them through treatment, ringing the bell, seeing the end of treatment, helping them through the side effects is, a fabulous nursing role and very, very rewarding. We've come so far in oncology. It's such a different world than it was then for treatment, and so many of our diseases are cured. So I think it's really a rewarding practice in ambulatory care. I think there's so many opportunities to grow that role and, make that role what an individual nurse wants.
I stayed at Fox Chase for 5 years, and I left so I could work somewhere a little closer to home. But when it came time for me to look for another job, I knew I wanted to go back to Fox Chase, and it really was like coming home. I manage 2 clinics. One of them is pulmonary medicine. The other clinic that I manage is the plastic surgery clinic for reconstructive tattooing for women who've had breast cancer. It really was like the first official time I could incorporate my love of art and my love of helping people.
I've been a nurse for 20 years. There's a lot of jobs. There's a lot of different avenues. And Jonathan, everybody I tell about your job, that you're a tattoo artist and a nurse, they're like, I want that job. This is where I was meant to be, and this is my calling. There is a great interdisciplinary team atmosphere here. We work very closely with the doctors, with the social workers, case management. We do something called interdisciplinary rounds, and being able to go in as a team together. You really get to do so much critical thinking, and your patient observation skills are so important here.
We have some of the best equipment. We have robotics, and we have lasers, and we have all kinds of high-tech instrumentation and things. We do state-of-the-art surgeries that keep us on our toes, and we're always learning something new. We work together with the surgeons, with the anesthesia department, with the technicians. Nursing is always, I don't want to say fun because it is a job, but it's always exciting here.
The clinical research nurse plays a very important role in running the day-to-day activities of clinical trials in collaboration with the physicians and the investigators. It's exciting to be involved in these trials that are testing the drugs with the hope that one day this is going to be available commercially to patients for use with cancer. Appetite still good?
It's not as good as it used to be.
As a research nurse, we are primarily the patient's point of contact when they join a research study. We are the person they call with any type of side effect. If there's a change in their medication, they call us. Some studies require them to come a couple days a week, so you end up building close relationships with the patients, which is something I enjoy. It's great to be part of a team that is hopefully affording patients options and treatments that are not available everywhere. and potentially will improve their lives.
The graduate nurse program at Fox Chase is great. We try to make sure the new nurses are comfortable by the time they're done. So there's no place you can go where you get 6 months of being with another nurse. Now I'm mentoring Tony. I always want to make sure he's okay, but I look at him now, he's going to be a great nurse, so I don't have to be that protective. What I like most about being here at Fox Chase is being part of my patients' journey from the moment they walk in here to the hospital. They allow me to be part of their family, and for me, that's the greatest feeling.